Hi there, my name is Mary Warren, and today I'll be discussing practitioner burnout in clinical psychologists. So, what is burnout? One common issue within clinical psychology is practitioner burnout. Practitioner burnout is a long-term stress reaction, which can include symptoms such as emotional exhaustion, depersonalization, and feelings of decreased personal achievement. Burnout can develop under extreme pressure, and possible causes include feeling either constantly overworked or under-challenged, being under time pressure all the time, having conflicts with colleagues, an extreme commitment that results in people neglecting their own needs. So, clinical psychologists and practitioner burnout. Research has demonstrated that healthcare providers are at high risk of occupational burnout, which not only has implications for the practitioner, but for the patients as well. Clinical psychologists are particularly susceptible to emotional burnout due to the nature of their work. In a survey done by the American Psychological Association, it was found that over one-third of psychologists are still reporting burnout, with early career psychologists the most likely to report burnout. Burnout in psychology can impact the practitioner in many ways, including their personal well-being, their professional identity, and their engagement with clients. The impact on the psychologist can be detrimental to their mental health and may leave them exhausted and not feeling their best, and may also impact their work if they are unable to recover from the burnout. This may also have financial burden on them if they are not able to retain clients. They may not be making as much money as they could be or as they previously have. The impact on the client may mean they are not receiving the care to the best of the practitioner's ability, or the practitioner may have to cancel or reschedule sessions frequently due to not feeling their best, as burnout can also lead to more susceptibility to illness, as they are not getting the rest they need, lowering their immune system. Stakeholder outcomes may be affected because if the practitioner is not performing to the best of their ability, they may struggle to retain clients or get new clients coming in. They may also be calling in sick more and cancelling and rescheduling appointments, leading to a loss of income for not only the psychologist, but the clinic as well. So now I'm going to discuss a proposed solution to the practitioner burnout within clinical psychologists. So one solution I believe that could be to this problem could be to create a community website where psychologists can interact with one another and share self-care tips. Research has found that social connection and self-care were strong positive factors against burnout. This community site could be a place for psychologists to connect with other people who also understand the emotional burnout that comes with the job. It can also be a great place to gain access to mindfulness and self-care techniques that are not only from experts of the field, but from people experiencing the same emotions as you. What would be really great about this is that obviously psychologists are experts in mental health and very good with like mindfulness and self-care practices and are generally very good at passing these on to their clients. So this is going to be a great way for them to be able to discuss these sort of self-care things and also be able to implement them into their own lives where they may not be so far. They're also going to get better ideas from other people who may specialize in certain areas of mindfulness, who are also experts in their own field. And this may really help with that sort of emotional regulation within the burnout and help them to decompress, especially after a long work day. Previous research in the medical field has indicated that creating social connections, especially within the same field, helps to combat burnout. This feeling of friendship and of the community that they might make while using this website can mean that they have people to reach out to when work becomes a bit too much, who really understand what they're going through and how their job is impacting their emotional and even like physical well-being sometimes, as burnout, as I said previously, can lead to higher susceptibility to illness. So now I'm going to discuss the implementation of this solution. So websites are really good as they can reach a wide range of people of different demographics and areas, and it is not reliant on people being in a certain place at a certain time. And websites are really easy to access and share. They can be sent via links, sent through phone messages, emails, all that kind of stuff. They can be implemented within clinics, which means most psychologists can also be exposed to the community page, which is really great as well. A barrier for this implementation may be that some people may not have access to the internet at home or may be uncomfortable using the internet. So, to help overcome this barrier, clinics can make the page accessible at work and have members of staff who are more confident with using the internet and navigating web pages help teach those who might not be. This is also a great way for people within clinic groups as well to start discussing these sort of like self-care things and get to know each other a little bit better by pairing people up and helping them use the web page, which can also help create more friendships and more relationships along the way, which can also help combat that burnout, which is kind of a side effect of how the website is going to work. And here are my references. Thank you so much for listening.